Hey, Dr. Durrani here with another episode of Scrubs and Software, and today we're talking about EKGs and AI. Really cool tool that I found that I've played around with, not really used clinically, but just curious as to see how it works. It's called PMCardio, and so essentially what it is it's an app. There is a fee to use it. I believe it's around $30 a month. And what it claims is you download it on your phone, you take a picture of an EKG. There's a couple of conditions that it can diagnose, obviously the main one being a STEMI, and you can use it for that. I think it is useful to kind of talk about how traditional EKG machines work and then how this is different, because like we all get EKGs in the ER clinic setting, and it'll have some type of interpretation at the top. And so how does it come to that? It's usually using a rules-based algorithm, and so what it's essentially doing is it's saying like, hey, if the QRS is like greater than this and the rate is greater than a certain rate, then it's probably a ventricular tachycardia. And so it essentially does that through a bunch of kind of rules-based algorithms it has to give you those interpretations at the top. The main thing that's different about something like this app that is AI is it has machine learning or deep learning models. And so essentially every time someone uses it, it's using that information to be better next time. A traditional EKG machine is not going to have that. It also has contextual understanding, and so when I'm playing around with this, what it does is it asks you like what the presentation is, and you can kind of put that in. It also asks you what the result is, so maybe it calls something a STEMI, and then maybe the patient goes to a cath lab and they have clean coronaries. You can actually give it that feedback, and so once again, it's getting better. And so that's how it's different than that. It also can, like I mentioned, interpret other conditions like AFib, flag you for like things like hyperkalemia. Apparently it can guess ejection fraction. That's one of the tools it has as well. But it's this app. Now because I'm screen sharing, it won't let me take a picture, but I've used it to like find example EKGs with various conditions, STEMI obviously being the most curious one I'm about, and I've used it and it's been pretty impressive. But what you can do is kind of use this sample button right here, and you can kind of click this get results button, and so it has like a sample EKG loaded, and it's basically going to show this. It'll so this is what the original will look like. That's basically what the picture would looks like, and then it digitizes that. And so this is kind of telling you that there's concern for a STEMI or STEMI equivalent. And then this is what I was talking about. You can add a clinical presentation to kind of help it get better. And so it'll ask like, is there a clinical suspicion of acute coronary syndrome? You could like hit yes, and then it's going to kind of give you with more certainty that it's a STEMI. It also has what it calls these heat zones, and so you can kind of tell where it's really confident about a certain read it's making and where it's less confident. So obviously, if it's ST elevation and it's really confident in that area, then that's going to help the clinician make that call. So this one, it's basically saying sinus rhythm, incomplete right bundle branch block, no other conditions, and obviously then it calls a STEMI. It gives you all these measurements that it gets, and like I mentioned, I took probably 20 or 30 pictures of various EKGs online. Was pretty impressed with how accurately it was calling all of the things that were actually on the EKG. Now, in the United States, as you could see at the bottom of the screen, this isn't like an FDA-approved device or anything. Probably shouldn't be using it in the hospital to be solely making medical decisions. We obviously use our own decision making for that, but I think it's a really cool tool that shows the progress that we've made. In the EU, it is actually a Class 2B device, and I just kind of have the page pulled up here. And basically, a Class 2B device is slightly more complex than Class 2A devices, generally medium to high risk, and will often be devices installed in the body for periods of 30 days or longer. So pretty advanced devices, so I imagine they're probably working on getting a US authorization for that. There's 36 core diagnoses that it can predict, so things like AV blocks, atrial fibrillation, atrial flutter. It can take a picture of any 12-lead EKG, including ones on computer screens, which is helpful because a lot of times, an EMS unit may send a EKG, and you may just want to kind of see what this says about it. Other than that, used in many countries. I know they do have many university partnerships, in the US included. So really cool tool. Another thing that I think, definitely in the next few years, it's probably going to be something that's going to be integrated into actual EKG machines that we use, and those reads that we get at the top will probably be more accurate because we all get those EKGs where it says STEMI and you're like, yeah, that's not a STEMI, and you sign no STEMI. And so hopefully some of those will be more accurate. But another kind of cool AI tool I ran across, wanted to share. And once again, if you have tools that you want me to evaluate, share my thoughts on, create these little mini episodes around, let me know. Happy to do it. Thank you.